Welcome back. No doubt you have heard this story already. We've got a health alert about a disease uncommon to our area, but tropical kind of really, suddenly popping up by the dozens of cases here, and it's dengue fever.
Yeah, that is what we're talking about. And so far, there have been nearly 200 confirmed cases between New York and New Jersey. That is concerning, with a significant outbreak right now in Puerto Rico as well.
Yeah, mosquito-borne, which is why we're showing you these giant pictures of the mosquito, because that's where they come from. But what exactly is dengue fever, and how concerned should we be? Helping us understand everything is Dr. Sharon Nachman, Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Doctor, thanks for joining us.
Good morning. Nice to see everybody.
Hi, nice to see you.
We've all been chatting, and I think the biggest question that we all have is, are these cases generated here, or are these cases from mosquito bites that happen elsewhere and then that patient travels here?
Good news for all of us. These are travelers. These are patients that live here in New York that went on vacation, perhaps to Puerto Rico or someplace further south, got their mosquito bites there, and brought their virus home.
I guess the next big question is it, can you transfer it between people, and how do you treat it?
So the answer is no. This is not a respiratory virus. Sneezing or coughing or touching someone who has dengue is not going to pass it to you. That's the good news. I guess the bad news is that we really can't treat this virus. In fact, most of the illnesses are self-limited. These patients get better on their own. They feel crummy for a few days. Fever, muscle aches, joint aches. It takes time. They will get better.
So, Doc, and then, if you're traveling, and all of us are, I mean, we've all seen the airports. Everybody's packed into an airport. What do we do when we're going someplace where these mosquitoes might be? Is it we just have to spray ourselves up?
So I think it's a little more complicated than that. First of all, these mosquitoes feed at dusk and dawn. So while most of us are not up at dawn, a lot of us are standing around this swimming pool or open water at dusk. That means that's the time the mosquitoes will find you. So definitely using spray around that time is going to be key.
Can I ask you one more thing, too? I believe one of your specialties is working with kids. Is there a difference in how this presents in kids and the elderly? Should we be more concerned if we find someone who has the symptoms?
No, it's no difference really with regard to diagnosis or treatment for kids or adults. And they get the same muscle aches, joint aches, fever, and feel crummy just like adults do.
Okay.
So before we let you go, we said folks are getting this probably primarily traveling. Are we seeing more cases of it? I mean, is dengue fever and mosquitoes that are carrying this, are there more mosquitoes carrying it? Why are we seeing the numbers up? Besides just the traveling, because people have been traveling.
So there's a few reasons. The first is that we're better at diagnosing it. We have a great blood test. It's easy to order, and you can make the diagnosis relatively easily. But more importantly, the mosquitoes are also traveling. If you look at past years where the mosquitoes were sitting, they weren't as far north as they are now. So maybe 10 years ago, we didn't see this many cases in Puerto Rico or perhaps in Brazil, and now we're seeing many more cases. So over time, the mosquitoes have traveled. And as you can imagine, over time, we're also traveling more. So it's both things.
Well, we need to put them on a no-fly zone, no-fly list. And, hopefully people will be okay. Fingers crossed. Take precautions when you're
That was good info, though. Doc, thank you so much for being with us. I appreciate that.
Yeah.